So seeing that it's 1:05 and we have a quorum of the board here, we'll go ahead and get started. So Colleen, let's turn it over to you for an update on our local COVID situation, please. Colleen, I can't hear you.
Yeah, sorry about that. There's like a bullet over my mute button, so I didn't realize I wasn't speaking. But as many of you guys are tracking, we are now up to 66 positive cases. We got 5 positive PCR, so that means active infection cases yesterday. With that being said, there also has to be recognition that testing has been delayed across the state, not just here in Lake County, for up to 2 weeks. So basically what's happening at both commercial labs and state labs is that priority tests, so those who are critical care needs as well as emergency surgery, those tests are being sought after first. Like those tests will go through the lab first. We also know with a lot of the commercial labs that they have been testing both our surrounding states, which is kind of bogged down, our testing as well. So like I said, when I hear some folks complaining about what's happening in Lake County, it's actually happening across the state. So depending on what the need is or why you're getting tested is how the labs are prioritizing that test, if you will. So if you are, and so basically, yeah, so it just depends on where you fit in that priority. And so they are working on, at the state lab specifically, they are working now to have 3 shifts going 24/7. And so we are also laying in some supplies from the state lab to ensure that we have access to that lab through the supplies that they send. So right now, both Rocky Mountain Family Practice as well as St. Vincent Hospital does have testing supplies that they can send to CDPHG lab, which they do currently, but there might be the ability to redistribute some of which way the testing is going. And as you can imagine, if everyone starts redistributing to one lab to another, then we're bogging down another lab. So what's difficult about that is that some of the cases that have come in, they have already, and we saw this at the beginning, when labs were bogged down, that some folks have already done their quarantine, if you will, and or isolation if they're sick, quarantine if they were exposed to someone with positive COVID-19. What the good news is that we continue to see clusters of families, if you will, and or folks that have gathered. And so I kind of wrote that down as that take-home point. It's like people living closely together, indoors in a shared space are the ones that are kind of passing around to each other, which encourages me that some really great habits are happening out in public. It just is when folks are kind of in their own home doing their own thing, that is where we're seeing a lot of that transmission occur. We don't always know when this, like who or what source brings it in, if you will, but we do know that that's where we're seeing a lot of these clusters of folks. So that is encouraging in the sense of some of the habits that we continue to see out in public. This week, we are really trying to whittle down to get some triggers and some measurements in place so that we as a county can kind of be tracking where folks feel they have a little bit more confidence on seeing what's happening. And so much of that is around, capacity. It's around what's happening in the sense of, in our community. It's when those tests were done and or returned to us. And so it's a lot of moving pieces. So it's really hard to say, hey, at this number is when we're going to start doing X. It's more of, here's the 5 things we're looking at. This is where we start to have more conversations. So for example, if we hit a certain positivity rate, that kind of triggers us to meet more frequently, to kind of be on top of it, to say, okay, what's your capacity? Do we need to start, setting out some messaging of what we're seeing and why we might need to kind of tamp down on a few things. I think I'm seeing that both Paul and Ann are on this call. I have some thoughts around, going back to special events in the sense of, I know the last time we spoke, we're talking about only accepting applications for, groups of 50, if that's still where we're at, or is that something that we really need to change our public health order in the sense that we still know that most exposures are happening in group settings where, we become a little bit more strict in the state, which talks about that social distancing calculator. And we've, had a pushback, as you both know, from folks being like, oh, well, if I'm at Ice Palace Park, I can have 175 people. there when they're just looking at the square footage of the park, which really isn't accurate when you think about, that means that everyone has to stand in their own square 6 feet apart in the park, which we know that's not what an event would, dictate, in the sense of, folks want to come together. They want to be, all kind of hanging out together, and that does not, that's not very conducive. And that could be a conversation a separate day, but it's just something that kind of came up in a meeting earlier today. And I was just curious if we had a few minutes to, talk about it as a work session. It's kind of a small group, but I think that that's kind of our big push this week, trying to hear kind of where the school district's at. As you can imagine, like, we have no authority over, what they do or don't do. They just, we have the ability to support them to say, yes, they're in compliance with the public health order, overall. And so, we're here to support them and what we think is, the best way possible forward. And so still trying to kind of tighten up that loop, as well as, a lot of decisions are being made, without, and not negatively, in the sense of, like, they really have to figure out what their capacity is, what their model is, before they kind of present it to say, hey, we think this is the safest way we can do it. Can you support that kind of thing? So as we all know, everything feels like it's on a time crunch again, and, a lot of work in a short amount of time to kind of keep moving things forward, if you will. So that is where we're at. Tomorrow night, we are doing a town hall at 6 p.m. So we're trying to see if the school district has the ability to have someone there to represent, even though we know we don't have all the answers. But as most of you guys can attest, it's lots of times we're on a town hall, we don't have all the answers. It's important for us to kind of be in, to be available for the community to see, kind of where their questions and where their needs are. Because I hear when people see 5 cases in one day, they don't recognize the fact that those cases were from 2 weeks ago. They were tested on different days. And then also recognizing, hey, that was part of a known cluster that we were testing people, versus something totally new that we, weren't aware of, if you will. And I think that's something to communicate as well. And that's what I have.
Thanks, Colleen. So I think we're able to go ahead and have a conversation today about special events if you'd like to.
Thank you guys.
Paul and Ann, if you want to tag in, I'll let Colleen start, and then we can just tag in as we see fit.
I think the last we spoke was we were talking about, only accepting applications of events with, groups of 50. I don't know if that's still true.
I would say so.
Yeah.
Why? Have you seen other proposals, Colleen?
No, I think what I'm starting to see is something that wouldn't necessarily come through the special permit, as in I had a phone call that I need to get back with the district ranger about outdoor weddings happening in September, where that's something I don't think that normally floats past us, but because that we're in this, they want to know, hey, what should they be telling people about, weddings and gatherings. So when you look at the state public health order, it says that folks, like for life rights, you can have up to 100 people gathered. And so the question maybe that I'm posing more than anything, it's not like we're sending weddings through the special event permitting process, but I am just looking for some oh, look, weddings that are on public property need to contact us. Okay, because it's the Forest Service. Specifically, it was Suzanne Martin who reached out to me that I was going to punt that to Jackie and Becca, because I have a call with them here in a little bit to kind of catch up to see where we're at for the week. So I guess the question is, in the public health order that we supported, it does say life rights up to 100, but I'm just not familiar with like some of the spaces that they're at. And the question becomes, do we need to adjust our public health order to really just say 50 across the board, whether it's funeral, whether it's wedding, whether it's special event, so there isn't the confusion that there is, right? That happened with us with the borough race, in the sense of, the gentleman felt very confident that he could do 175 safely. And when we started having the conversations, we thought like that does not feel good. And so that's kind of where I am at. It's just, like I said, because of the folks that are in this meeting, and this is a work session, like, can we talk this through a little bit? Or, yes, so that's where I'm at.
Okay.
I'll stop talking.
No, I'm glad that you brought that up, because I was, you know, I think more and more people are going to submit, you know, proposals. And I think that there's a difference a little bit between, you know, like the borough race, that's a private event, that's not, they're not promoting it to be a spectator sport. But then, and I see Chris writes in the chat, what's the status of the Lake County Community Fund dinner? And, you know, I think that there's been some confusion there as to what has been reviewed or approved. And to me, that's, I'm very curious to see what they've even proposed, because that's supposed to be a social event. And for me, I think that, you know, if there's one thing we heard from the business advocates, feedback is to lead by example. And for me with this, it's kind of like, okay, well, let's not maybe promote those kind of gatherings, though it's happening elsewhere. Do we need to kind of add, I guess, to exposure risks? Yeah, I mean, I don't know if that's really necessarily fair to say. Open for debate and discussion, of course, with you all, based on one event here. But, you know, my mind kind of goes to prioritizing and knowing that the school district's going to open. Let's pare down and really focus on having the staff capacity to deal with that, and not be maybe exacerbating some concerns or issues.
Anne, can you talk to us a little bit about the community dinner?
She said her audio isn't working, Paul.
Well,
Go ahead.
it doesn't look as though they've even submitted an application yet. So we don't know how many people they're proposing. And Sarah, I completely agree with you. This is a social event at which we need to social distance, which is an oxymoron.
Right.
Which is completely in conflict with each other.
Yeah.
And I don't even know if, so we don't know what they're applying for yet.
No, and in my conversations with Brett at the airport, he's not entirely sure of the scope of their idea at this point either. I'm supposed to be meeting with him and with Brett and Mayor Lave this afternoon to kind of understand what that looks like. But he was not sure of the scope of what they were proposing either.
I see. I didn't even know that the event was looking at being held at the airport.
There was like an email that had come in, and I can't say that you were on it, Paul, by any means, and I don't know how I came across it, if you will, but talking about like a tailgate party up at the airport. So with over 100 people, you know, limited to the amount of cars that come in, but not necessarily the amount of people, or maybe it was like 175. But the point is, like, I think when I hear of tailgating, and it's not like there's a venue in front of you, like, hey, there's going to be a movie, and everyone's like focused on a movie, and you know how to behave to drive in a movie, versus, hey, this is community dinner, and how are you supposed to explain, like, you have to stay with your car, you can't, like, you have to park 6 feet apart, like, there's so much that comes with it, and maybe there's, you know, opportunity there, but my point is, like, it may not be worth it, even, you know, do all this time and energy and work to put it together, and I'm not comfortable necessarily with having, you know, like, kind of to Sarah's point, like a county facility promoting an event with 175 folks, if you will.
Yeah. And I think
that would be pushing the limits anyway for the area that they would have available at the airport to utilize. Like, there's not the opportunity to utilize the runway. The runway is open. So people can't park on the runway and be socially distant from another vehicle anyway. You would have to be in that parking lot.
Yeah. Well, and Colleen, to your point, I think that's, you know, I think I'm glad we're having this conversation, because I think that, you know, ramping up into the any projected spike or, you know, again, increase on our capacity and ability to meet whatever demands might come of the county or city staff, hospital, you know, emergency responders. I I think that what you're getting at too is a bigger question to the policy group to now like outlay the next 2 or so months, right? Like the way we canceled the special events, and also to not just in special events, but community behavior, so that we don't have to spend and spin wheels and spend hours on something like this when we all seem to be kind of on the same page, although I think we need to more formalize that, expectations set by the policy group, where we're going to move and what we're going to spend our energy on in the next month or 2.
Right.
Yeah, Colleen, sorry, I didn't mean to cut you off. Would this be part of a mitigation plan with us seeing spikes in case count? Do we have a plan created to say, okay, if we see an increase in case count and we go over 5%, between 5 and 10%, here's the actions that we take to mitigate further spread that would increase us from 10% to 15%. Is that something that we have or that we're working on, or would this event planning or decision play a part in that?
Great question. So we are working on that. So right now we're not required to have a mitigation plan until we go past our numbers in the sense of what the state deems us as being high risk, which we go up 1 week and then we go down the next. So we're not on the radar in the sense of like, hey, we're consistently above 5%. We're usually anywhere between 5 and 7%. And so even now looking at some of the mitigation plans that are out there, like I want the exact detail that you're talking about, Kayla, and I'm trying to use our regional partners to be like, hey, can you help us just put even some percentages in? And then we kind of have a group moving forward that then we propose that to the policy group and our board of health to say, hey, this is where we're at. And I think that was my point earlier, is that it's so dynamic, right? It's not just, hey, we hit 5%, which for us that usually averages out to about 8 cases every 2 weeks. And so when you think about 8 cases every 2 weeks, it's fully manageable capacity of the hospital, us to test everyone in that group, as well as trace 8 folks every 2 weeks. And so that is my goal by the end of this week and early next week, to have something that I want to have a mitigation plan, even though it's not called for right now from the state. I think it's smart that we have it, and looking at a regional one. We came up with one, but it's like but it's just so vague, and I want us to be a little bit more precise with the understanding of, okay, but then where's the flexibility? Like it can't be hard and fast, only because, hey, we recognize there was this big event, we've got 10 people sick from this one event and no one else is socialized outside of that event, and therefore our numbers might look bad, but our ability to infect other folks in the community is actually low because it was only this one isolated group, if you will. Like I said, we continue to see kind of family clusters and our folks living closely together, and so it's just trying to figure out those pieces. But I think that begs that question of coming up with those numbers. I'm working with, and we just had a preliminary conversation earlier today with Dr. Lisa in the hospital to really kind of put some of those things to paper. We kind of all have our own idea in our head about where that trigger is, but I really want to put something to paper. And I think that'll help our community tremendously as well, to be like, okay, this is, I don't have to start like getting heightened every time there's 5 cases in, one day. And we know that's definitely a reporting thing, not necessarily an accurate picture of what's happening and when we get lab results, if you will. So I will work on that, and I think that's important to push it in front of the policy group, as well as our board of health, to say, hey, does this make sense? Once all of the stakeholders kind of behind the scenes, we're all coming together, and I will hopefully have that proposal submitted to kind of the hospital and Rocky Mountain Family Practice, because they're such big players in this, as you can imagine, as well as, I'm doing kind of just checking with my staff for different pieces of where we really think our thresholds are at this point in time, now that we have a lot more experience in contact tracing and what it takes.
Yeah. I wonder too, if we can, at a minimum, when we're talking about that mitigation plan, put something out there, and help me articulate this better and work through this, but put something out there that's messaging to the effect of, here's what we won't do, or we realize, and we know we won't do it because we can't support it with enforcement or whatnot. Like we won't step backwards necessarily. And I'm talking theoretically right now. We won't step backwards in, closing down restaurants and going back to takeout only. Maybe, I mean, we won't do that. And therefore this risk will maintain, we anticipate this, you know, maintaining a certain level of risk. You know, something like county offices, you know, we're going to close. Here's what we can do as leading agencies. We can reduce our public exposure or any potential for transmission. And so we would plan to do X, Y, and Z in, you know, continuing Zoom meetings, not encouraging social special events. And I'm sure the list, we could come up with a better, more comprehensive list, because I feel like as long as we're pretty clear on, you know, here's what we probably will and will not do and enforce, then we can kind of address that issue that is kind of surfacing with folks who still don't feel like maybe they're being protected enough in the community, just to try to figure out how to send that message that we're not prohibiting, you know, we're still not prohibiting anybody from taking those precautions for themselves. And the expectation, yes, they will, you know, businesses will remain open and continue to operate. And we will increase our support to businesses and our understanding of what it might mean should they take their own measures to limit their hours, or, you know what I'm saying? Just be very clear about what is happening. Because I don't think that at any point we've necessarily, I mean, I think, sure, we talk about and speculate, there might be surge and we might have to go back into shutting down, but I don't know. I think that might be causing confusion. And if that's not realistically what we can or plan to do, then we should be clear with that. And that should come from the policy group, right? Based on your recommendations, Colleen, so that heat is taken by the Board of Commissioners and not.
This is Chris. If I can just chime in for a minute.
Please.
I would caution you against making statements affirmatively saying what you won't do. Just because none of us have a crystal ball, and the way
Sure.
a lot of elected officials get in trouble is by saying, oh, we're not going to do this, or we'll never do this, that, and the other. And all of a sudden unforeseen circumstances come up and you're doing precisely what you said you wouldn't do. I love the idea of putting it out and say, here's what our plan is, what we will do. But I think leave yourself some flexibility as to what you won't do.
I mean, we can say it's unlikely, right? It's unlikely that will revert back.
Yeah, I was gonna say, I love it. Lawyers' favorite language is what we call wiggle words. You know, make sure you leave yourself some wiggle room there with whatever you put out, because if you put absolute language out there, people are going to hold you accountable to that absolute.
Right. I mean, and I'm thinking, you know, comparing that to, you know, what we train every year with our emergency operations and liability, that Tim Gablehouse comes to us and says, your liability is in making promises you can't keep. You know, you tell somebody that we are not prioritizing your property and it may burn to the ground, you're fine. I mean, those are clear, realistic expectations that you're setting. You can't promise everybody that everyone's house will be saved in the event of a wildfire based on, you know, our true ability to respond to that.
Yeah, absolutely. In fact, the anecdote for that is my first year living here, I went to a wildfire mitigation meeting, and Dan Daly essentially stood up and said, here's what we will and won't, you know, defend. And I immediately hired people to do tree mitigation. You know, so that when they drive through the neighborhood, they see my house has a nice berm around it. Maybe that'll offend my house. But that's saying what you will do, I think makes 100% sense. Just be cautious about saying what you won't do.
Right. Thank you, Chris.
I think like I said, once we kind of figure out where we're comfortable with, you know, both public health, the hospital, same or Rocky Mountain Family Practice that we kind of will get a better handle on. And I think one of the things we recognized was, even say, as you know, like we don't have access to the folks until their tests come back to us. We don't have the ability to intervene. We don't have the ability to, be in that office when they're getting tested to say, who are you with? What's, where were you and all that other stuff. And so, obviously we're behind the ball, which all public health agencies will tell you that that's happening, across the state. We're all, kind of been put in this, unrealistic position. And so I think really working and, increasing the communication, moving into the fall in the sense of, reestablishing some of our calls that we had, or public health had with some of our stakeholders, just to say, how many outstanding tests do we have? What do we think that positivity rate is, which usually is about 5. So if we have, I'm so bad with math off the cuff, but I'll say we have 100 outstanding. That means maybe 5 will come back, right? If our positivity rate is between 5 and 6, maybe 5 or 6 of those will come back positive, which is, better than we have 500, outstanding tests. So I think that's just a piece of the puzzle that we're trying to bring back in, because we don't also have that information. We don't have how many outstanding tests there are unless we seek that information from both Rocky Mountain Family Practice and St. Vincent Hospital, which obviously in the beginning we, we're very diligent about, but as we've kind of come into this kind of breathing moment of trying to get all our other, increase our staff, get all of the other, prevention measures in place that we need, communication and so what. So that we need to kind of go back to some of the basics that we were getting in the beginning, so that we have a better picture of it, and not have, and everyone talking in one meeting and not doing, 20 different meetings, and here, snippet there, and go from there. So we are recognizing that, and we're going to tighten that up pretty quickly.
Tighten up. I'm sorry. Healthcare provider communication.
So tighten up our communication pieces with the hospital and Lisa, even though she and I talk, weekly, but it might be, hey, on this day we're going to report out, and this is how we're going to do it, and we're going to recognize, what some of those. I mean, we already do our community lifeline report, but I think, even looking at Lisa's data, like it's so it's almost like behind the scenes piece, because we wouldn't be like, oh, all this is happening, we have no idea what that test rate is. It's just more info for us to have, so that we're, kind of prepared just to know what might be coming into us in the next 2 weeks of folks that are being tested today, if you will.
Colleen, are there like, I'm thinking of like the tobacco cessation and like how BAG engaged with local healthcare providers to ask like that list of questions, or to provide resources for folks to support the reduction of tobacco use. I mean, is that kind of the same concept that has been getting used, and or are there like 5 questions that Lisa's office or the hospital could ask to kind of give you guys a jump start on that contact tracing, should anything?
Yes.
And or send out and give the patient and say, okay, depending on the results, here are the things we want you to think about, and here's, what we want you to jot down in case you do need to talk to public health.
So we did approach them a while ago, and we're told that that's not something, they feel like there's already enough paperwork, because we do have all of that, but I think they might be more comfortable to revisit this right now because of that gap in timing. Like when we were asking that was like tests were getting turned around in 48 hours, but now they're getting turned around in 2 weeks. So we actually have all that paperwork, everything ready to go if they are open to giving it to the clients. So we will circle back on that one. So I do appreciate that, Sarah, because yes, we had thought that would be super proactive, but recognized too that they felt their staffing, they couldn't do it. And so now I feel like there might be, hey, this is important for us to get this info now. So especially when people's minds are fresh versus, 2 weeks later, and or they have a positive diagnosis, and then, their minds, on 100 other things versus where was I, now 4 weeks ago, because that's how far back you would go from the time they were tested with symptoms to, when they might have been first exposed.
Colleen, how does that lag in testing results affect our public health orders?
In what respect? You mean like in Safer Home, we don't have any parameters that we have to meet, or at this point in time, the state hasn't come up to say, hey, if you hit this amount of, at least for Safer at Home, I'm trying to figure out a way to say this, that right now it's like you're just here to like be as stable as possible in the, in the area that you're at, which is safer at home right now.
Yeah. So, I mean, with that data being 2 weeks old, are you able to project like potentially people that were in contact, if like potentially these amount of people may have a positive test result based on their interaction with this positive test result? Or is there just not any way for us to forecast any potential positive cases into the future? Or are we still looking at like the test results we got yesterday as an example that are 2 weeks old? How does that affect where we're at right now?
And I think, I mean, that's been the case from the beginning. So lots of times, right, when we're having conversations, we talk about like, hey, the information we have right now isn't reflective of what happened in the last 2 weeks. It's happened, 2 weeks prior to that. And so we had those conversations of like, hey, we still don't know what July 4th, has looked like in the sense of our numbers. I think we're in a much better state now, knowing that we're about 2 weeks out, and I think we're closer. But I hear what you're saying in the sense of how do we project, but I think that becomes, recognizing, hey, do we ask these people to get tested specifically, right? Because we know they've been exposed to a COVID person, so we can just, assume them positive and start those conversations, which we've been doing. So anyone that we've told to get testing, we are doing that right up close and personal, like, hey, you now have been identified. Where have you been? What are your contacts? So we are catching some of those proactively before they even get tested, because we know there's a known exposure. It becomes a little bit, obviously more important to get really detailed information once they are, come back positive. So I think we can get better at that though, Kayla. I think there's ways that we can look at it, but we've always been looking at data 2 weeks behind. And I think that becomes the trend. And even, when you think about Polis, who opened the bars, and he saw within the 2 weeks that the bars, had been open, and the data that he was able to see right away was, we're going up fast. We know it's because of these pieces. I'm not going to wait for 2 more weeks to actually get the full picture when I can already see it. And so I'm thankful that it is as tough as that was, to make a decision on his end, I'm sure, but recognize that there's some patterns that are obvious and there's others that aren't. So we'll keep rolling.
Thanks, Colleen. I appreciate it. Does anybody have any other questions for Colleen specific to Lake County's COVID emergency? No? Colleen, what is your expectation of us for a decision on special events?
No, I think it's, if we're still just taking applications for groups of 50, and we think that that is, depending on the space and where they're at, if we think that's a doable, event, then I think, we don't necessarily not look at them, if you will, if we think it's something that folks can do safely, because you can. I mean, it's been shown that you can really do this well. And the unfortunate part is the social piece where, if there's alcohol involved, then masks come out, or if there's a lot of eating, then masks come off and people are talking closer. And so, I'm still comfortable with that. I don't know that we have to pull the plug, at this point in time, unless I don't know that we have a big influx of applications coming in. I think, only in, and or Paul can answer that. It looks like Paul's shaking his head no.
Paul or Ann, do you guys have anything to add in regards to that special event permitting process?
I think the question sort of boils down, should we not accept special event applications, or should we accept them? Or should we accept them at a certain number of participants? Sort of like 3 choices there. And I don't have an answer. I think that I don't even know if we've issued the borough race permit yet. We're expecting the community dinner application to come in next few days, maybe.
Can you hear me?
Now we can. Yes.
Okay. Okay. So the borough race has been approved by all agencies with some conditions. I think I've sent that out. I did hear back from Jackie with a public health response. The event is not having a short course any longer. They're leaving Lake County at 9 a.m., projected to be out of the county at 10. They have some setup at 7, but they're going to have signage that says it's a private event, no spectators. And so I do have some conditions for the permit that I will send out to everyone. The only agency I haven't heard back from is the Sheriff's Office, and I sent them an email today asking them for comment, just to ensure, because they are going to be on 7th Street for a short amount of time prior to the race. And so we've already talked about making sure that they don't trespass onto any personal property or private property in that area. But I would like to have some response from the SO before I send it out to everyone. And I will email that out just like I did the comments so everyone can see it. I would just ask, the last special event meeting that we had, I kind of communicated a discomfort with making an administrative decision typical of the process this year. However, in the last email I sent about the borough race, since we almost have a consensus that the new plan does feel that it is something we can approve and support, does the board feel comfortable once we have consensus from the Sheriff's Office for staff to go ahead under all of the conditions, and I'll send those conditions out again for review and any additional comment, to go ahead and do that through the normal administrative process? So I guess that's my first question on that one.
I think, yeah, and apologies, Anne, for not kind of flagging that question that you had for the board in your email there. I would be comfortable with that, especially but making it clear that this is because it's a private event and there are no spectators, or also I think Paul maybe said at one point 50 participants or less. I mean, we're still talking about 50 people overall, right? Volunteers, coordinators, and participants.
Correct. And that's also conditioned, so that it's memorialized. And then we do have the ordinance to back it up if anyone were to ever try to do something outside of what's allowable under the permit. So yes, that's total. It's not just racers, that's supportive staff, anyone engaged in the private event.
Okay. Commissioner Marcella, do you have a opinion on the administrative process versus, well, now that I'm sorry, I will just shoot in there also thinking back to, taking the burden of any kind of public backlash on that. Your initial kind of weariness on making that administrative decision, and I do not want to say that we need to approve it for any reason other than that is our role as the policy group for those decisions, and any public feedback to fall back to us rather than staff.
So you're saying bring those applications to the board for formal approval?
I just think that that's a consideration and not something that I meant to dismiss.
No, I totally agree with you. I think, I think part of the process, to keep that process very unbiased and not put that burden on staff, but to retain that decision-making responsibility on our end, I think that those should come to us for an approval, so that we can say we're taking the application and the comments from the review agencies and making our decisions based on those comments.
Okay.
This is Chris. I just want to chime in one more time and just suggest that if you know that you're leaning towards, if the consensus is to lean towards limiting events to 50 people, given what it takes for a group to put together the special event application, I highly recommend you get that information out there, because I think it's going to be really frustrating to the folks, and most of these organizations are volunteers. You know, of course, the community fund has staff, but other groups that might be thinking about having events in the fall are mostly volunteers. And so asking them to put together something where they think they may be able to have more than 50 and then come back and say, no, it's only for 50. Give them the opportunity to decide if they want to put in that effort to make the application if it's only going to be open for 50 people. Does that make sense?
Mm-hmm.
I might like to point out, though, that if anybody's been paying attention, and I suspect there's a lot of us that haven't, that the gathering limit that we're currently under is 50 people. Is that not so, Colleen?
I was just answering Kayla's question, but so basically from the public health order, and that was kind of what I was raising earlier, is that for outdoor venues and events, people have the ability to gather in 175 if the social distancing calculator, right, if it actually is conducive for social distancing, and so it's in there with the thought of, you know, we might have one venue that would be able to go over 50 safely. And so it's hard. And so that was my point of, unless we truly want to make it hard. So we made a decision as like a group, as for special events, specifically for the county, we were only going to look at groups of 50, regardless if outdoor events and venues, you know, still allowed 175, right? That's kind of where we got into that little confusion space with the borough race. So like, oh, it's 175 and I'm doing all these pieces and we can make it work. And then we decided as a county that for our special events that we would only accept applications for, you know, groups of 50. And so there is in the public health order where it does say exactly what Kaylee put in there. But the thought was, and that was my thought, like, hey, do we need to make our public health order more strict and just limit all groups to 50? We take it out of the mix of 175 folks. You know, obviously we can revisit that come fall, but is that the step that is that where we need to decrease that confusion piece, right?
Thanks, Colleen. That's kind of what I was getting at.
Yeah, and like I said, we have the ability to be more strict. We're still being safer at home. We just decided to restrict group size overall, regardless of what it is. And so there wouldn't be those ambiguity, am I using that right? Between like the public health order when someone's like, well, it says 175, but I think that's the space that we run into is that someone, like I said, Ice Palace Park, 175 people could technically stand in their own little spot 6 feet apart, but not move anywhere to still be within social distancing. So that's kind of where we're at.
So
we'd have to amend the public health order and kind of, you know, we had that one in place, so it wouldn't be that hard for us to say, hey, just to make it across the board that it's, you know, we take that piece out, that this is a piece we're doing differently than the governor's order, but we have the ability to be more strict.
well, what's happening here is that I think since we initially last May decided to cancel all of our special events, I think we sort of had an idea to get back and see what the situation again is in the middle of July. Well, that's sort of come and gone, and we're sort of settling on, we limited, and the borough race did apply for 175 people, and we told them to apply for 50. Mm-hmm. And pretty soon we're going to get an application for the community dinner. I don't know if we're going to be expecting any more, so I don't know how urgent this is, because I'm not anticipating a lot of special event applications.
Well, I think with Ann saying earlier that, you know, the fire service reaching out to me saying that they have folks who want to have weddings at Twin Lakes, you know, on public property, you know, for 100 folks, because that is the limit per the state order for life rights is 100 folks. It's separate from venues. It's totally separate. Is that a possibility? And so I don't even know, like, if folks are trying to get married in September, right? And so for some folks, this might be like important now, kind of make that decision of what that looks like. And so I think when I think of some of the spaces out in Twin Lakes, I can imagine spacing people out. I mean, even if you're in family groups, that would really be conducive for, you know, groups of 100. But that's just me not knowing all the places where you can get married out there. I only know like 2. Like I said, I think there is some relevancy to it, because I think of somebody who, you know, there's been some folks who obviously have had their weddings under the radar, didn't share, and just went ahead and did it, right? Because it's on private property. And or they, you know, they did their public ceremony there and then, you know, ran off without permission. And so I think it's, you know, where do we get there? So.
We have had one wedding that started communicating with us prior to COVID. And, you know, we kind of kept in contact for a while, but then they dropped off. So I really think having good messaging for anyone that approaches us about a special event. And I don't think that we can always anticipate, you know, like the borough race wasn't an annual event. Filming crews are random. I think that it's really great for us to have some good direction for inquiries that come in, because I don't think that we can always know, you know, what might be being contemplated. So it's really nice to have a consistent message, like Chris mentioned. And, you know, there's a lot that goes into planning events. So I think that if you set an expectation, and I also wanted to mention that I did a pandemic special event, like addendum to the application that additionally addresses what we think that protocol you should have something that accompanies your special event permit application that, you know, addresses current public health orders. And so I think that just having good information whenever we're approached is great. I'd love to be proactive about it and not just assume that, you know, we won't get them, or so I really like that idea.
I think it's fair to make that, you know, to determine whether or not we have a consensus to go that route. I agree. And I would be in favor of that, just to make it abundantly clear, to make the messaging clear, and to kind of, yeah, narrow the focus overall.
Well, I guess not clear to me. How many people?
I think it sounds like 50 is the, you know, recommendation, and that's what's been followed thus far. And that's for I mean, yeah.
Yeah, that becomes, I mean, I think that's to Paul's question, is it still would be confusing, because life rights, you can have up to 100 if you can social distance well. You know, outdoor events and venues, you can have 175 if you have, you know, the right amount of space. And then the question, and kind of almost back to Chris's point, is if we, you know, limit our special events to 50, which I know that's where we're at overall, like, I can't imagine the time and effort, like, to do all of these procedures just for 50 people, because then by the time you volunteer, you might have like 30 people at the event. And I don't know if that's really revenue generating or worth it, or, you know, worth all of our time and energy to go through all these applications for just 50 people versus like, hey, we're just not taking anything until like September. So we don't have to worry about that. I think, Anne, you know, you said that we should still go through the review process. I'm just trying to weigh like, you know, efficiencies as well as like, and maybe somebody can pull it off and it's worth it to them. And so I, you know, and that's the piece where I struggle, where I don't want to take that opportunity away from someone who thinks they can do it really well, and it's worth it to them to do, you know, the time and energy to have a COVID plan for a small event.
We've done 3 since we've kind of worked through these new parameters. So we had the filming, we've had the Bowman event on private property, and now we have the borough race. So you know, I kind of hate the idea of thinking, or I'm reluctant to kind of think that, you know, not any, but so hopefully maybe we could find way to support some of these smaller ones.
Well, and some, you know, I mean, do we need to break it down into further categories, not just of size, but looking at local, you know, morale and boosting kind of smaller events, ongoing, you know, the virtual events that are happening? Are we even seeing those come in for any kind of review? Go ahead, Chris.
I'm sorry. What I was going to suggest is maybe I hate to suggest something might be burdensome, but would it be possible to break it down to where there's a preliminary application, like an intent, letter of intent that's sent to building and land use that kind of just outlines what's being proposed. So before they go through the heavy lift of the full application process and everything, that they can get some sort of feedback as to whether it will be approved or what the parameters might be, so that they have more information to work with in making that decision.
Yeah.
The only thing that I would be hesitant about that with Chris is that we try really hard not to, it is a lot of energy to try to kind of help design it. So as long as the parameters are kind of basic, I just, you know, we always kind of struggle with this anyway, with kind of untested events or new events, you know, kind of them leaning on staff and the review agencies to tell them how to do it. So as long as as long as maybe those are just kind of some good basics, and not, you know, relying on us to design it. And that might seem basic, but you'd be surprised at how many new events kind of just, you know, continue to come back to staff wanting to know how to do everything from a route to, you know, so I think as long as it's kind of some good basics.
Well, and I think that's a great point. And my suggestion is you control that by giving them a form that they fill out that limits the information, you know, that they have to provide you with the information, and it's not really the reverse, you know, type of thing. So it could very well just be a one-page form that could be developed that goes out with the application package and ask them to return that one-page form within whatever period of time you think is reasonable, just so you have that preliminary review. And so that, and there's nothing wrong with putting on that form, you know, kind of the same way we do with self-help forms and the courts and stuff like that, to where we can't provide you with legal advice. So, you know, this is just to collect information to help you decide whether this is a feasible event for you. But no, I agree, Ann, you don't want to be in that position with folks.
I guess I'm a little bit concerned about here that we're trying to create a framework by which we will be willing to do this or not willing to do this. And yet so we create that framework, and yet that somebody makes application to which the intent is not being complied with. So we always have rules and regulations, and we always, and you can pipe up with this as much as I can, that we always get somebody that wants to do it differently to get around the rule that may or may not actually comply with the intent of the rule or rules that we come up with. So, you know, I kind of like Chris's idea of, you know, have somebody tell us what they want to do and then let us respond to that, rather than simply filling out the entire application and then routing it around. Filter it out, because we could actually have a conversation with the applicant and simply say, we don't think that you're complying with our pandemic parameters.
And I would say that we kind of, you know, already do that informally. You know, did that with the borough race, just send it out, you know, and indicated, hey, this is just kind of a preliminary survey of the agencies. What do you guys think about this? What, you know, commissioners, what do you think? So, you know, we kind of already do this informally, certainly this year for sure. But even in non-pandemic years, when we get a new large event, we've always worked together to create a situational awareness and had an internal meeting to look at new large scale events. So I think we've always kind of created that kind of collaboration and kind of preliminary, hey, what from your department, what would be your concern regarding this? So I think we've always, this would support kind of how we've always looked at new events, even in non-pandemic years.
Non-pandemic years, I like that. We can go back to the Middle Ages here, talk about Black Death. My initial reaction to a community dinner is, how could this possibly be complying with our pandemic parameters? And it makes me wonder whether there are others that are out there that are also not paying attention to the pandemic. Well, I don't know. I suppose we should probably get a hold of John McMurtry and have a very conversation with him.
I'm meeting with him, the airport manager, and the mayor this afternoon at 3:30 to have a discussion about this very thing, to understand the scope and the capacity of what they're asking for or expecting to have at the airport. I really do like Chris's idea of having them submit just like a one-pager to you guys to say, here's what we need, here's what we don't, like type of thing. I also really am in tune and in line with the 50-person limit, and just limiting it to that, through September. Because I do agree with Sarah, if we're trying to work towards finding a solution for the school district right now, we don't know what that impact is going to be into September, of what that's going to look like. And I think we have to let that play out before we can start. Like, that's just one more incremental step before we can start rolling out additional events, if that makes any sense.
I think so. I also wonder if, and I don't think it's gonna necessarily, assist in the review, but I wonder if we don't encourage, just put a simple statement on the headline of whatever paperwork we might give out as requesting initial, letter or information of intent of an event, and just say, hey, we encourage, virtual events, or we do have our, plenty of visitors and tourists coming through. If there's a way that you want to promote, your event that typically happens in non-pandemic years, and can think of a creative way to do that virtually, or other, marketing aspects, that would be great. I just don't, I don't know that we are going to see the floodgates open on applications coming in. And I do think that it seems like we are at a consensus to kind of maintain clear boundaries of how many resources we want to put towards the review of this. I like Colleen's comment there. I did the same. So I don't know. I think 50 sounds like what it should be. I think a quick review and shooting that back out and to referral agencies and or the board maybe first, or board and public health to give initial reactions. And then we could figure out who then connects with that potential applicant to give a response. But
okay.
Is that helpful? Have we covered all that? I mean,
so I would just like to shoot everybody I called it the special event application announcement and COVID-19 pandemic response, 2 special events. So it's got a lot listed on there of what we would like to see in an application. So I'll send that back out. This accompanies the special event applications. And then if I can try to put together, maybe add on to this kind of a short form of who, what, where, how, kind of asking for preliminary before they fill out the application to help guide them through it. And so if I could just send that out to everyone, and if you'd like to comment or edit, I do have at least a starting point, so maybe I can throw a little bit more on there and then send it out for edit. Does that sound okay?
Sounds good. Anne, do you mind copying me on that
Sure.
as well?
Sure.
Thank you.
All right. Everybody feel good now at this point? Better? Okay, cool. We're at 2 o'clock right now. Sarah, do you want to dive into some CARES Act information at this point, or would you like to wait for that for tomorrow? And we can dedicate the hour tomorrow to that.
I do not have anything following this meeting. I know a few of you do. I'm actually having a hard time pulling up the document that has the comments on there. But is there, maybe we want to spend 10 minutes going through some other questions or considerations?
Sure.
Okay. And I'm sorry, again, I am having a hard time pulling up the kind of living document, if you will. I don't know if anybody can help me figure out how to pull that from Teams. Anybody? Anybody?
I'm trying to on my end.
Might have to screenshot it, but I'm not sure. And then like share it to yourself.
Okay,
So I can just, Sarah, can you open it at all, Sarah?
let me, I think the only way I did that was through, let me try. I can open I have the document without. I apologize, everybody.
That's okay. So I can start with just a few questions to maybe Janine, if that would be okay.
Sure, please.
Sure. Here, Janine, can you speak? So Sarah had in her working document a comment around the childcare proposal that you had made, and I was wondering if you could speak to that a little bit and clarify what that money would go for.
Well, I think it could, it's sort of still unknown at this point. But, you know, at some point we were looking at what it would take to get childcare back up and running, and if there would be some costs associated with that. Partially, I think any justification for costs related to childcare would be that folks who need childcare and can't work due to lack of childcare, then that becomes COVID related in the sense that it's impacting their ability to return and recover economically. And I would say especially for families who were impacted by layoffs or furloughs, and then if childcare becomes their next biggest barrier, I think it's important to try to relieve that as we can. Now, it will be interesting to see what the impact of school opening is, because that certainly allows school-age children to be able to return, but there's still no care for younger than that, and with limited capacity at the center when they reopen. So Just wanting to make sure that it's on the list somewhere. It may not be needed. It may be that it doesn't need to get accounted for, but with all the things that were going on with Bright Start, whether that was repair of the current facility they were in or trying to set up accommodations in a new facility, there could be costs associated with that. So, and then also just recognizing the impact that's happened on families, particularly when there's a stay-at-home order. You know, quarantine, especially an extended time, does really impact children. And there's lots of research and good information out there about how to build resiliency related to that. And so just wanting to make sure that we're aware and investing in opportunities to identify when that's needed and help the family build resiliency. And childcare and activities for kids has been really important for that. So, you know, it could be after school time, out of school time, some additional things that could be specifically focused on building resiliency, especially if we identify families that are struggling. And we are seeing that. We are seeing families that have had some impact of not being able to either economic impact or some other mental health impact. So I'm just thinking in terms of there's need for additional supports for families and kids. But I don't know what that amount might be. It's sort of open-ended, but I just thought it might be nice to have something if that's a need that starts showing up.
So Janine, does that also, one of the additions here too was mental health support for law enforcement and staff, and or, I mean, to your point, overall or throughout organizations to be able to continue to provide access, at least to. Do we have any kind of feedback from Solvista on, you know, continued successes and challenges and demand from the community?
I can double check and see what they're registering. I think and we may see some of that. We know that we're seeing an increase in the number of, we have had quite a few child welfare involvements. Law enforcement has responded quite a bit recently to different fairly intense situations. And I can check with Solvista. I think the other thing that's important would be areas that are not necessarily showing up on the radar, but we know they're happening, and they may have more of a long-term effect. The other area that you're going to see this show up is kids having trouble adjusting going back to school. So I definitely think you're going to see potentially some need for some kind of interventions or some types of additional support to the families and to teachers. It's going to be a big adjustment period, literally for kids to have a schedule, to have a routine, to be interacting with each other again. You know, things that were challenges back in February are still going to be challenges, and they're going to be potentially be exacerbated. So I think there's going to be a need for things that you may not be able to measure as specifically, that would be important to help address either behaviors that are showing up, or just acknowledging the fact and recognizing the fact that this has been a pretty traumatic, drawn out disaster. And anything you would do for kids to follow up from disaster, I think we should think about implementing those kinds of things, helping establish routines and norms and traditions or whatever they might be, just sort of reacclimating to what that sense of normalcy looks like. And so we can gather some data. We do have some of the initial stuff. I don't know that everybody's going to reach out to Solvista, and I do know they've been busy, and the telehealth has worked really well. So you've got that end of it. But I also think you're going to just see an overall sort of sense of being overwhelmed, especially in families where they're still not recovering economically. That's really been tough on families. It's been tough on parents, and then the kids are there and they haven't had a break. And so I think those kinds of things, they're not necessarily all going to reach out for mental health, but I think if we can think about what that could look like for supports, and maybe even support the school district in their particular activities or things that they define as helpful for kids, I think that could be valuable as well.
Janine, do you have, is there any kind of plan? I was just kind of thinking of a couple of people that I've been able to push towards, you know, reaching out to their, I mean, even outside of our community, their public health agency or Sol Vista in their community, and wondering if any kind of testimonials or could be helpful. Is there, or creating some sort of environment where you know, fellow community members can also help encourage.
Yeah, so are you talking about like a little bit of community messaging around mental health and reducing stigmatization, that kind of thing?
Yeah, absolutely. Yep.
Yeah, I think that could be really helpful. You know, one of the things that we have known and that we have seen is the challenge in working with the Spanish-speaking folks well and doing a really good job of it. I think some messaging around that could be helpful. Maybe even some peer training, you know, those kinds of things. Because I think it's important to identify who are people currently talking to and reaching out to. You know, what are some good methods to do some messaging if folks want to come forward and say this has been helpful to us. I know in our wraparound program, we've seen a lot of that. And then we've also seen a lot of homelessness and worrying about eviction. And, you know, so we've been helping families through that type of a crisis. And then we, of course, try to make those mental health connections there. There could be some folks there who could be willing to share some of their stories, both, you know, from the past or currently. And I think they, you know, so this has been busy. I don't think they've seen a drop off at all, but I don't know that people have necessarily, it'd be interesting to see how many new clients they have seen over this time period. But we could work on some messaging. I think that's another piece of it. I think just that resiliency, especially directed towards children, is just sort of a need that we're definitely seeing coming up.
So Janine, we did get an email from Becca with the school district asking about potentially doing some outdoor type cohorts for K through 6. Would that potentially be something that we could subsidize?
Yeah, that's exactly the kind of thing I think that would be helpful. A big piece of that is recognizing that sitting in a classroom for kids is going to be a tough stretch. So, you know, as they're planning to do, let's rotate kids outside, inside, you know, not put, try and keep the numbers who are exposed to each other small. I think that could be helpful, especially if there's some components related to building resiliency and some mental health. And I also think there's going to be a need to address kids that are really struggling.
I have to go ahead. I have to agree. I think, you know, when we think about resiliency, we have to think about the social emotional aspect that goes into those early years of childhood education. You know, that like the Head Start model is really centered around is developing those social emotional skills and recognizing, kind of like you had said last week, Sarah, that everyone has gone through kind of a traumatic experience where, you know, for those children in preschool through 6th grade, let's say, you know, their place or their space may be a classroom. That might be the safest place for them. And so recognizing or understanding what we can do to supplement that to help with that healing piece of this experience and add to that resiliency.
So do you have questions about that, or does it feel too obscure and not certain enough?
To be honest, after talking through that with you, I'm not sure that that dollar amount is quite enough to help to maybe assist the school district with some of that, or with all of those needs. But again, I don't know what their plan looks like at this point, and I don't know what families are planning on in the fall as well. So I don't know the amount of families that may determine that they would rather homeschool than put children in school, or do an all virtual experience for their children. But still being able to offer them something like you're talking about, Sarah, like a health class or something like that. What does that look like if the school district offers a virtual online setting for families? Can those children still be offered like a physical education or a specials type of environment or structure? Or
well, I was thinking too, like maybe even training, train the trainer, kind of supporting teachers or coaches or whatnot in just talking about that in the day-to-day. I know there's a lot of that, like social, emotional development, of course, that we focus on, but really targeting it in a way to communicate the availability of a resource, destigmatizing, emotions and people's experiences through that, not only for the students, but for their families. Yeah, and I think again too, I mean, I don't know what number we put to that. Certainly having to spend these dollars by the end of the year, there needs to be some sort of programming or plan brought up, but there is kind of a contingency of that $187,000 that I would suspect is kind of floating at you will, if you will, to then reallocate for a line item like this.
I think too, we might want to include in here potentially, Sarah, maybe some kind of assistance for our aging population. I don't exactly know what that looks like at this point, but I'm not sure where that fits in, but maybe talking through some of that need with Colleen and Judy and Janine.
Yeah, I think we should assess it a little bit, and Judy might have a sense of it. I can tell you our APS caseworker might have a sense of that as well. So we could assess, what would be helpful, whether it might be, some kind of little home visitor program that's safe, done outside while it's still nice, those kinds of things. We might be able to think about investing in some of that.
Yeah. Have you seen an increase in APS cases through the pandemic, Janine?
No, not
Okay.
really. I think folks are just isolated. We know that isolation and depression for seniors are highly correlated. So I think that's a really important factor to just recognize, and even if it's people calling to check on them or trying to help them feel connected in some way, I think is important as well. So you're right.
So I just like to chime in here. Like we can, once again, I would say that, hey, a process would be great to gather some of this information. And I would tell you, like when it comes to the school district, we have no oversight. They are the experts. They're aware of all of the things that we're talking about. So it's more of, if we had funding, how can we support it first? saying, hey, we think you should do this, health program, like they're beyond taxed at this point in time and trying to implement something in addition to just the day-to-day. And I think, folks are aware, and so much of, to the point in the beginning is truly just getting kids, into some kind of rhythm and pattern and recognizing, all of the parameters that are now in place for, COVID-19. So I just, I don't want us to like spin our wheels on things that we don't even actually have the ability to input on, versus how do we elicit some of these questions that you guys were talking about so that we can support folks effectively. Like I know for our senior population, Judy's been in touch with everyone that we have contact with and asking questions and seeing, what their needs are. But you got to recognize so many of these things are non-COVID related. And so that's something to keep in mind as well as, for seniors specifically, so many of these issues that they may have, they've had before COVID, they will have after COVID. And so we can't necessarily there's funding for that. It's just put it out there. Thanks.
Yeah, but I mean, I think we can, because of CARES funding, we don't have that face-to-face interaction and that social interaction that's so important to mitigate and try to, alleviate some of those ongoing stressors in general, Colleen, is just unable to happen. So I'm sure that we can frame, targeted support there in a way that's not, it doesn't have to be like stress because of being, medically impacted, or so to speak, by COVID. But
well, there's actually
points
some
are
good
well
tools.
taken.
Yeah, there's
What was
some good
that?
tools out there. There's some good tools to help measure for folks too. Some of the assessment tools that are out there are things like how much have you had to worry about contracting COVID? How much have you been able to have, somebody to talk to? And so I think before just spending it on seniors in general, we could evaluate maybe a little bit like how much were they impacted by this, and then what can be done to sort of put some resources into place to help mitigate as best we can. But I would look for something that's measurable as well. The same thing with kids, what kinds of things were coming up for kids. And there's some tools out there that I've been looking at that are sort of what are the impacts and how do you measure that, and then how do you build some resiliency around that too. So it wouldn't necessarily be a catch-all for all of the issues that are facing seniors or children, but maybe just some things to help at least bring folks back to pre-COVID. And again, we don't know how long this is going to go on either. So I think that's the other thing to measure is how are we helping people build a resiliency towards coping with this in the long term too. So we could look at that. We could probably evaluate that.
So I just have to push back when we say we can look at that, we can evaluate that. Who is the we in this equation?
Good question, Colleen. I can have some staff work on that. What I'm envisioning is just thinking about resiliency for the community as a whole. I could have some, I've done a little bit of that actually already for the kids, just because we were seeing so much going on with families. So I think it wouldn't be impossible to dedicate a certain amount of hours to at least looking up the research and seeing and putting maybe some proposals forward to coping with that. And some of it's related to...
Sorry, Jean, sorry.
No, go ahead.
Well, I was going to say, or is that something we can use our funding to have someone to do some of that work? Because I know that, we continue to be taxed and we can continue to, kind of push back on some of the like, hey, I don't have enough time, and or like my hours are getting, COVID-19 centric versus, is there opportunity? It's just all I'm asking, right? I'm putting that there for me and for you. And I'm trying to say, like, you do not have to do it all, Janine. Is there opportunity to bring someone in very quickly who can do this from afar, who can pull that information together for us? So that's not.
Yeah, that's it. I think that's a good point. I think we could look at that. It's something that we are talking a little bit across the state. I can also find out what resources are being developed across the state, because we are seeing it. So the families that we helped with financial assistance, we are seeing some of them continue to struggle and continue to have other challenges. And then some of them, you know, we are working with some families who experienced homelessness, related or not related, but during this COVID period, in our wraparound program too. So we are seeing some of that. But yeah, I think we could find out what's being done, and you know, I don't know if you want me to work with you on this a little bit, Colleen, but I could probably put together a proposal about how we can build resiliency specifically related to. And you know, what's interesting is if you focus on the child population and the senior population, you kind of catch everybody else in that as well, because what's good for them is often good for others who are struggling too. So I can just talk with some colleagues and see if folks are doing some specific things and what they recommend. If we should hire somebody to coordinate that. I'm envisioning this could sort of be a piece of what our caseworker does if we get that position hired for, because they're going to be the ones talking with folks every day as well. And I think Carla at Full Circle, who is working with these families on an ongoing basis, is continuing to see some of this as well, where families are still struggling a bit, and we could look and see what would be helpful. So those are good questions. I don't want to just assume that it'll get done, but I think we could work towards a proposal on something like that.
Yeah. Janine, so it sounds like we would want to make a determination on that caseworker position, though, sooner rather than later then.
That'd be good. Yeah.
Okay.
Yeah.
Say that, you know, to Janine's point, like seeing all the case management that just takes up so much time. It would be great to have someone dedicated that way. You know, obviously Full Circle has shifted. We provided some funding that we got to them specifically for, you know, case management of our men needs for COVID. But I think, you know, to Janine's point, like this is bigger and it's not going to be over at the end. And so I'm all in favor of supporting that case manager position in human services.
It seems like that role that Full Circle is also playing right now kind of is that maybe a stepping stone, or will be instrumental in providing feedback and ways in which we go about developing needed support through someone in that role.
Yeah. I think too, it's just worth, you know, having a few days to digest and go through that preliminary working document of that budget. That, at least from my perspective, the goal is to really leverage that money and make it go as far as it can go and have the greatest impact that it can have. And so I you know, going back to your point, Colleen, about, you know, these things will still happen regardless of COVID. I think for me specifically, supporting things like senior programming or educational programming is really like, you know, we wouldn't have to adjust for additional classrooms or additional parapro staff to help with children that may be behind because of the lack of resources for the last 5 months. And so I think really this is just putting that money into the roots of our community and making that money just go as deep as it can go. So I think of it as watering our plants. You know, we want to really try to make this money just go as far into the roots of our community as we possibly can, so that, you know, the impact is lifted and reduced collectively as much as possible.
No, I can appreciate that, Kayla. It just, yeah, nope, I can totally appreciate that. I have to admit, like, you know, and I hate to be like, I feel so negative, which is so not like me, just give it all, but just recognizing that, you know, it's a big amount of money for a short amount of time. And we know if there's something, you know, already established that we can pump that into, like your point is to really deepen those roots that are already, you know, in existence and, you know, and water that plant. Yes. So versus starting, you know, trying to start something brand new, which
as you know, from my experience, it takes more than 6 months to get up and running, and then managing it, and then actually nurturing it. And then by 3 years, you're like, yes, finally, we got to see some change, which is great. I mean, that's my day to day, right? That's just, you know, life in public health, but recognizing that time frame as well. So
Yeah,
Right.
no, absolutely, Colleen. Okay. Moving down the list.
So I don't know if you saw my note earlier, Sarah, with SBDC EDC staff. The EDC is currently advertising for an assistant for Marla to do some of that work.
Right.
So we might want to talk to them about what that might mean. Maybe it could be going into that centralized database. Like in Northern Colorado, they have a database where they put a list of all these resources. You know, you click this link to go to Bank of America, who can help you with your PPP loan, or you click on this link and it takes you to the SBDC Women Entrepreneurs Grant, or you click the, you know, just like that collective database for the business community. Maybe it could be used for something like that with the EDC.
I'm sorry, better switching from human resource support to better communication format?
Yeah, maybe just developing that database, developing that website,
Yep.
that collective website.
Yeah, I think that I have a real problem with some of the things thrown out there, and maybe just on my surface reaction to some of that communications piece. I understand that there definitely needs to be a better format, or at least exercised better, right, internally and publicly facing. And so I believe that all the elements are out there to push people towards, and we don't need to create another new hub for that. We just need to decide what that hub will be, and then what gets pushed out from, you know, the county website, say. And I think that from Jamie's presentation to us from the SBDC, I almost feel like this would be kind of like a case manager, like we did have talked about on the recovery groups for the business community alone. And I guess what I'm trying to say by that is, you know, ways that we've experienced challenges in utilizing like the COG housing, you know, director, or because of proximity and just not having kind of somebody here who really, I guess, speaks the same language and really can be a liaison. I'm thinking of it more like that, and not necessarily staffing, you know, providing long-term staff for the EDC, and but some people, a role that might be more specific than the idea of the Main Street ambassadors. Does that make some sense? Or not
Yeah,
really?
it makes some sense.
Okay.
Cool.
And I don't, yeah, I mean, because those folks, you know, Marla's getting up to speed. If she hires staff, they're getting up to speed. And so how do we, you know, as we've seen with many of board members who are volunteers who have wanted to dedicate time but have not been able to, in some of these recovery efforts, just kind of being sure to have people whose prime responsibility is to provide that and perform those functions.
Yep. Cool.
I don't know how we. Maybe that's something to talk about more at the recovery group.
Yeah, we could. Did you want to use our work session time tomorrow to go through this a little more in detail
Sure.
and start delegating and coming up with an action plan?
Yep.
Okay.
Yeah.
Colleen and Janine, you guys are welcome to join us tomorrow at 1 o'clock, but I know that you are very busy. And so if you can't, we totally understand. But yeah, that would be great. So
Okay.
do you have anything else, Sarah, before we adjourn?
Just a quick note on that, this line item of GOCO or land acquisition, to kind of highlight again, you know, we are talking, as we should be, an awful lot about people, but to highlight a lot of potential opportunities that we have to continue all of the work that we need to continue on, you know, protecting our natural environment and a community, and for us all to maintain a certain quality of life. There's a lot of combined opportunity out there. And so this was something that I can certainly go into greater detail on, but would cover, you know, a lot of the strain on our lands and open space and recreation areas that we are seeing, that would address a level of recreation management, could potentially be a revenue generator for the county, an investment towards that, so that we can, you know, be sure to continue programming and provide access and safe and beautiful and clean places that we all enjoy so much about living here, so that we can have some mental wellness, or which I should say contributes to our mental health. But yeah, I can elaborate more tomorrow, or just want to touched on that too.
Yeah, I think if you could tomorrow, that'd be awesome. I don't mean to cut us short. I just need to get prepared to go to the airport to talk through the community dinner stuff.
Sure. Okay.
So,
very good.
Thank you, everyone, so much for your very healthy conversation today. I really appreciate it.
Thanks, guys.
Thank you.
All right, see you tomorrow.